Good evening and welcome to our webinar sponsored by the Department of Health and Human Services. My name is Dr. Eric Griggs. I'm the Assistant Vice President at Access Health and Community Medicine at Access Health here down in Louisiana. Tonight we're joined by an expert panel, Dr. Jane Morgan, Dr. Obi Naidu. We're going to talk about something that is near and dear to all of our hearts, whether we want it to be or not. We're still in a pandemic, and it's that time of year. It's October, and October means football. It means kids back in school. It means Halloweens, but it also means, drum roll, it means vaccines. And contrary to a lot of popular belief, it means pandemic, and that's what it's been for the last 3 years. And it's time to do a test, just a status check to find out, to weed through the mud. COVID vaccines and variants, where are we now? Again, we're joined by an excellent panel tonight. We have Dr. Jane Morgan and Dr. Obi Naidu. Dr. Morgan is a cardiologist and the executive director of the COVID task force at Piedmont Healthcare Corporation in Atlanta, the largest healthcare system in Georgia. In this role, she serves, not surprisingly, as the COVID-19 vaccine expert. She additionally serves as the CNN medical expert contributor and is the owner and creator of the Stairwell Chronicles, which is a series of social media series directed towards addressing questions around COVID vaccines and other medical topics in a conversational format, much like we will do tonight. Further, Dr. Morgan has been named to the committee of the Department of Health in its series of Ask the Experts. Previously, she was the System Director of Research and Innovation and Director of Cardiovascular Research, where she oversaw clinical trials and set the strategic growth of Piedmont Research Institute. She has a litany and list of other amazing accomplishments, as well as being an adjunct assistant professor at the School of Medicine, Morehouse School of Medicine, and board member of the National Diversity and Inclusion Team at the American Heart Association, and the current health equity advisor for Moderna. I said all of that in one breath. I hope you're proud and I didn't damage my heart. Welcome, Dr. Morgan.
Thank you. It's a pleasure.
Dr. Naidu, Dr. Obi Naidu is a colleague and friend. We've been on this, we've served throughout the pandemic on several, when I say several, I mean more than several, more than 1 to 8 different COVID panels addressing this. Dr. Naidu's specialty is infectious disease. He is, Dr. Naidu, if you'd like to give us your training, I'd appreciate it because it's quite lengthy.
Thank you very much. Again, I'm very, very happy to be here. Thank you guys for having me. I went to medical school at University of Alabama, Birmingham, did my residency at Tulane University in New Orleans, did my infectious diseases training at University of Washington, and been back in New Orleans. I work at Ochsner Medical Center, where I'm the director of the infectious diseases training program here. Again, very happy to be here and looking forward to this discussion.
Among his other accomplishments, he is the program director for infectious disease program there, of course, at Ochsner. And let me tell you, he's an awesome friend. We've been, like I said, we've been at the helm throughout this, webinars, you name it, just trying to educate people and keep up to date with what's going on. First of all, I welcomed you already, but I want to let y'all know, I don't know about y'all, but I am tired. I enjoy what I do, and this is great, and we help people, and we do a lot, but I'll just say that I empathize a lot with people when they're saying, they wish this thing was over, and when will we be done? So the question I pose to both of you is, I know there's been rumors about, is the pandemic over? Dr. Naidu, we'll start there.
I would say no. It's not over. We kind of are in a new phase. I remember, Dr. Griggs, when all this was kind of early on, and we didn't have the tools that we have right now, which are the vaccines. We didn't know too much. It was all sort of brand new. And so I think that we're in a new phase in the sense that we have the vaccines. we're never going to get to a great herd immunity where we would not see infections in the community. There's going to be community spread. And it's likely that because of the way that this virus is transmitted, that during the colder months when people are indoors and in closer proximity to each other more, that we'll probably see more transmission. And so I think we still need to be vigilant in the sense that we still need to make sure that we're following scientific guidance as far as vaccinations, as far as getting vaccines. And people who are particularly from vulnerable populations, those who are immunocompromised, and those with certain chronic conditions that put them at higher risk, particularly diabetes, hypertension, cardiac conditions, may still consider wearing a mask in certain situations in order to stay safe. And so we're not out of it, as in we can't stop thinking about it, but we do have some tools and to keep us safe and to allow us to sort of be able to live safely even as the virus remains present.
Dr. Morgan, is the pandemic over? Thank you for that, Dr. Naidoo.
So it's absolutely not over, and it's really disheartening to see the lack of focus on the pandemic. As Dr. Naidoo pointed out, we still have people in society that are going to be very susceptible to it and are really dependent on us making good decisions about our health because it's going to impact public health. This is truly a public health issue, and for public health to work, the collective, that means all of us here together as Americans, the collective has to move forward together as one. And unfortunately, in the 2.5 years of the pandemic, we have not seen that yet. There's been so much undermining of the voices, the knowledge, the expertise of science by people with big platforms, but no science knowledge. And what we know is that people follow people that they trust. They don't necessarily follow people with the right credentials. So people have large platforms, millions of people follow them, and they give out all kinds of information that may be not intentionally misleading. It's actually what they believe because they heard it from another unreliable source. But we've seen other people specifically move towards malfeasance. And so there's no surprise that there is confusion and fatigue because there's a battle with regard to the pandemic. And just because we state that it's over doesn't mean that it's over, right? The virus is not talking to us and consulting with human beings with regard to what it's going to do. And certainly human beings are an integral part of the life cycle of this virus. Without us, without our presence, allowing it to invade our bodies, it literally can no longer cease to exist. It needs to invade our bodies to replicate and mutate. So absolutely, it's not over. We only need to look to Europe currently, right now, today, to have a little forecast into the future as to what we may expect in the colder weather coming here.
Thank you, Dr. Morgan. So you bring up a point, like my mind was spinning as we're speaking. And you know, Dr. Naidoo, we've been here on panels before, so I'm going to be a panelist. So, Dr. Morgan, it doesn't sound like it's ever going to be over. And if I'm not mistaken, is this not a pattern that we've seen in the past, that what happens in Europe is a foreshadowing of what could happen here? And if so, what can we do about it? So what is it telling us we should do?
You know, what can we do about it? Again, you know, when we're talking about what we have to do, it can't be the three of us. It's got to be all of the United States of America. It can't just be Dr. Griggs, Dr. Naidoo, and Dr. Morgan. And that's the problem. And we've got to really be able to get scientific voices out ahead of this. And I think as we continue to battle this, absolutely, we can expect another surge to be here. We have seen this pattern again and again and again and again. Every single surge.
Did you say again? Did you say again?
Yes. And yet we just continue to stay on this merry-go-round. So yeah, absolutely. We'll see it come up in Europe, and what's next? Then we will see it in New York, and then what's next? And then it'll be on the West Coast, and then it'll come to the South. It's the same pattern. And then we'll say, oh, I don't know why this is all. It must be the vaccines. It must be the scientists not knowing what they're talking about. And then all the, people with political agendas will come and start confusing the message, and then it's all a big mess, and we're back in the same status. And we absolutely need to make certain that we get scientific voices out ahead. I don't know how we get millions of people to follow scientists. We generally are kind of boring people. People don't really want to follow us on social media. They don't really follow us scientists. So I don't really know the answer to that, but we've got to be able to come together and make certain that people trust us. They already trust us, but they get their information from some other place. They do trust doctors, but they're getting their information from all the people that they're following. And then this information leads you down a rabbit hole. So absolutely, we already see, right, the wastewater samplings. I mean, what can we say? It just goes over and over again. Wastewater samplings are increasing in the Northeast, in the Midwest. We see it rising in Europe, on and on and on. We probably can expect another variant. What the variant will do, we don't know. Virus doesn't consult with us on its mutations. So we are just at its mercy. Hopefully it'll be a nice variant this time. Maybe it won't be. Maybe it'll be a mean variant. So this is kind of where we are.
And I just want to kind of
come jump on the merry-go-round. Come jump on this merry-go-round. Come on.
Yeah, I wanted to kind of chime in on something. You talked about a public health approach, and I think that's extremely important. A lot of people in the public space use the phrase personal choice, this and that, and that's fine. But for us to really kind of come to grips with this, minimize its toll on humanity, minimize its toll on people in the U.S., we have to have a public health approach. We have to think about this from a public health perspective in terms of how can we protect communities, how can we protect individuals. Obviously, people who have certain conditions are more vulnerable, but I will say we still don't. I mean, a lot of research is coming out now to say who gets long COVID and who doesn't, but we're still kind of learning as far as who. We know that about 10 to 20% of people who have COVID will have some type of long-term issue for months after they actually recover, but we don't quite. We're still kind of learning through this, and so it bothers me when people come with the perspective of, well, I'm going to be fine anyway. I'm young and I'm healthy. And that's more than likely you will be okay. But, one, we don't know for sure. Two, there are vulnerable people that you could pass it on to. And so I think just sort of following public health guidance, thinking about this from a population and public health perspective, we really need to kind of minimize transmission as much as possible. And that way we can keep our communities healthy.
And the other thing to think about, Dr. Naidoo and Dr. Griggs, and I often try to have this conversation with people, is you're right. You probably will be okay with this variant if you're to get infected. You're relatively healthy. But here's the issue. We need to play the long game, not the short game. And if you're that cavalier and are going to allow yourself to be available to be infected, more and more infections mean what? More and more mutations, which means what? More and more opportunities to create variants. Variants literally are clusters of mutations that come together. So even though you had an innocuous infection, what's the big deal? Why are you bugging me, Dr. Morgan? You now have increased the risk of a new variant developing that actually might be lethal to you next time. So the decision that you're making today may not be a great long-term decision for you later. It's a game of Russian roulette. That's the message that I try to impart on people. You are right. This particular variant may not make you sick enough to be hospitalized, but you now have just contributed to the problem of further variants being developed. And we've got to be able to put this to bed.
So those are excellent points. What I want to do is I'll puns intended. You obviously have a pulse on the community, finger on the pulse of community cardiology. Point. Bad joke. Yeah, bad joke.
I get it. Sorry. That was a bad joke.
Bad joke. I was going to say that obviously I'm having lighting issues, so I'm in the dark and y'all are in the light. Can we just stick to my day job? But what I want to do is I want to talk. You mentioned something earlier, Dr. Morgan, and I want to get your thoughts on this. You mentioned it seems to be you mentioned doing things the public health way. Dr. Morgan, you talked about doing things based on science. Well, it sounds to me like if you notice that it starts in Europe, you watch for a pattern that starts in Europe, it comes to New York, then it goes to the West Coast, then it goes to the South. Then there's this thing, Dr. Nadeau, you can talk about what wastewater is, this wastewater management that's part of public health surveillance. That sounds like science to me. I don't know, maybe I'm wrong, maybe I pulled out too much of my hair in med school and I pulled that part out, but that sounds like a scientific process. Dr. Nadeau, do me a favor. I want you to start with the scientific process and a public health process, the things I just mentioned. And then, Dr. Morgan, I want you to come in to kind of bring this home. Like, we've been dealing with this for 3 years and the dangers of being infected again. There's no such thing, innocuous. There's no such thing as a mild or benign infection, but we'll go, Dr. Nadeau, and then you bring it home on this. We're on the merry-go-round. Remember run around.
No, you're absolutely correct. One thing that's important to recognize is that the world is very interconnected now. And I think both of you have sort of alluded to that. And so what happens in other parts of the world, certainly we're connected with the rest of the world. And certainly Europe, the US, we're very much interconnected. As when the pandemic first started, it certainly hit Europe first. It hit the major populated centers in the US next, New York, out there in California and so forth. And then eventually the rest of the country sort of caught up. Now we have multiple ways of doing surveillance in terms of one, when positive COVID tests come in, if it's done at a clinic or at a hospital, it always gets reported in.
What is surveillance?
Surveillance is basically monitoring, essentially, and recording. That is what surveillance is. You monitor within a population, you monitor the rates. So how much how many people within this population are getting sick. That's one way of doing surveillance. Another way is wastewater, as you all sort of alluded to, which is collecting samples of water and screening it for different things. That's a way. That's usually an early signal. It's one of the earliest signals that we have that something may have made its presence into a population is by sampling wastewater. We oftentimes test COVID, new variants there, and then it makes its way into the population. Or recently in New York, we heard about polio. We found it in the wastewater there initially, and then ultimately sort of saw it, within the population. And so we have to follow the numbers, the epidemiology, basically the service, the surveillance, the data, in terms of guiding what our policy will be. And so the numbers, the data, the surveillance, and then what we know scientifically about the virus itself, the different variants, and then based on that needs to be the main thing driving what our recommendations are, what we do, and how we ultimately, get things under control. Yes, go ahead. I'm sorry. Go ahead.
No, please go ahead.
I just wanted to just touch on the Omicron variants, and a great point that you made, Dr. Morgan, and then I'll hand off to you, which was that definitely these Omicron variants, BA4, BA5, or BA1 all the way through 5, seem to be not as lethal as the original one and not as lethal as Delta. But as in, they don't hospitalize people at the same rate and they don't seem to kill at the same rate. But they are so transmissible, way more transmissible than those earlier variants. And so a larger number of people are at risk of getting infected, which then increases the likelihood that vulnerable people could end up getting infected. And so it's still something that we need to be kind of cautious of. There's still a risk that some new variant that's even more transmissible comes out. And so we definitely still have to be vigilant and follow scientific and public health guidance.
Thank you, Dr. Naidu. And Dr. Morgan.
Yeah, I was going to say all great points. And remember, the virus is actually being quite successful in this particular variant, meaning it has figured out how to survive. If it kills its host, meaning human beings, then it dies as well. So what it has done is it has mutated to a point where it is incredibly contagious, can infect as many people as possible, which increases its survival, but also increases its options of mutating and creating a variant that could be more of a challenge to us. So its very success has lulled some of us into a state of complacency. And so we have to be aware of that. And the other point that I would make about wastewater sampling, which is really quite good, and unfortunately, they ramped the program up and then they closed it down and then they brought it up in some areas and then it was spotty and then it wasn't being reported every day. So it's just been all over the place. But if wastewater sampling is done well, what we gather from wastewater sampling, which is the shedding of waste from your body that's in our sewage system and our water system, you can detect the early shedding of viruses before you have symptoms. So we are able to identify if there's going to be an outbreak or an increase in cases in a certain area early before people have symptoms, ideally, and begin to act. That's the beauty of wastewater. It gives us information ahead of symptoms before people may become sick or develop symptoms where they go and get a COVID test and then the test is positive, but by then they've been infectious with a highly infectious variant for 2 or 3 days. Wastewater sampling ideally should mitigate that because it gives us that information ahead of time.
So again, Dr. Morgan, since we're talking about all these, Dr. Nader done brought up Omicron 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It's to the point a lot of people are just like, I had it twice. It was just like a little cold and I felt a little sick and I was fine. Why do people say, why do we keep telling people there's no such thing as a benign or innocuous or a mild virus? If I don't feel that bad, can it still damage me like COVID? And what about my heart? What about my heart?
And so a couple of ways of approaching that answer. One is that long COVID is real, meaning the irony of this disease is that you could be sicker down the road than you were when you actually had the virus. You may develop some shortness of breath, inability to climb stairs, mental fog. You might develop that, and actually you were pretty healthy when you were infected. And so the paradox is you might actually be sicker later. And again, that's what I mean by playing the long game. It is about 20% of people will go on to develop long COVID. The more times that you're infected, it seems to increase your risk of developing long COVID. Some of it resolves over a period of time. And we see some people that have suffered for 2 or 3 years and have had to go out on disability. Currently, again, this is a risk that you take that has not been well elucidated or well explained, or is not widely known within the general public, again, because the voices of science are obfuscated in many respects and overrun by the voices of the non-scientific. But this is certainly well known within the scientific community. And so again, you run the risk. We don't know what the long-term symptoms will be, and we need to stop playing the short game and start to play the long game.
So playing devil's advocate, because we want to talk about where we are now. I'm going to be someone in the community, questions that I hear all the time. Say, Doc, look, you've been vaccinated a bunch of times, and I know a bunch of people have been vaccinated and had their re-ups, they call it. You can get it like I can, so what's the difference? Why should I get vaccinated now? And if I've had my vaccinations, then why do I need to get another one?
And certainly we've seen that these vaccines have not been as impermeable as we would have liked to have wished. meaning that they've been effective at keeping people out of the hospital and death, but they have not been effective at preventing infection. Now, that being said, the caveat to that is in many ways, our behavior created this, because originally the vaccines were very effective. And then as we moved through the various variants, they became increasingly less effective as the variants also developed some degree of, should we say, intelligence as they began to change. Don't forget, if a variant can invade your body while you have the vaccine on board, it has the opportunity to learn something about the vaccine as well. And so our vaccines worked very well against the earlier variants when we first brought those vaccines out. And then we saw as we come down the variants to Omicron, it became less and less effective at preventing infection. We saw that first change really with Delta, and then we saw it again with Omicron. And so in many ways, again, it's our behavior that has led to this. If we had been able to do what public health officials and doctors like the three of us were encouraging a year and a half ago, we may not be in this situation where we are today. But here we are with variants now that can evade the vaccines, which we really didn't see when the vaccines first came out.
And Dr. Griggs, I would just like to really stress the point that Dr. Morgan made in terms of the fact that human behavior, I think, has played some role in the emergence of all these variants. The vaccines, worked great at preventing infection for the very first version of COVID. As we've gotten more and more variants, the vaccines don't work as well to prevent infection, but all the data still show that the vaccine prevents severe illness, prevents hospitalizations, and prevents death. And there is some emerging data showing that the vaccines also minimize the risk of long COVID as well. Some data published in some of the infectious diseases journals. And so it's always important to kind of follow what the science is, follow what the data shows. The vaccine still prevents severe illness and prevent hospitalizations. Now, the current booster that's out there is sorry, what's that?
Update, current update.
The update, sorry. The current update that's out there, it is bivalent, meaning that it has a strain that confers protection to two strains that are circulating, and then it also has one of the original strain in there. And so this update is extremely important that everyone consider getting it. I think that vaccines will be our tool to minimize death, to minimize hospitalization, to minimize disruption of life. And I can't stress enough, having lost patients myself, having seen, what happened during the past waves. Everyone listening in, please consider, making sure that you get vaccinated.
So I want to can we just break it down? You talked about bivalent, and I'm like by corona, by COVID is what everyone wants to say, right? What vaccines are available? Who should get the vaccine? I'm going to throw out some scenarios that we get in the community, and let's just start from there. Either one of you. Where are we now? What vaccines are? Suppose I haven't been vaccinated at all, and I watched this amazing panel on a Tuesday night with three doctors, two brilliant doctors, and one with no light that's asking a bunch of questions, and it changed my mind. So I want to go out tomorrow. Where should I go? But more importantly, what should I do? Step me through the process based on where we are now.
So if you've never been vaccinated, we call that vaccine naive. you have not received a single dose of the vaccine from COVID, then you would not be eligible for this new formulation, this bivalent formulation that has the combination. You must start with the original monovalent formulation, and it's available with Pfizer, with Moderna, and with Novavax. The Johnson & Johnson is no longer available, so you will have to receive the 2-shot formulation for both of those. If you are vaccine naive, meaning you did not receive any dose of the vaccine since then. The new bivalent formulation is under emergency use authorization for use as a booster only. So if you haven't had any boosters, but you completed your primary series, meaning those first 2 shots with Moderna or Pfizer or Novavax, or even a single dose of Johnson & Johnson, then you are eligible for a booster dose. And the booster doses will be the bivalent vaccine, which has those 2 formulations, as Dr. Naidoo mentioned. You really don't have to remember that, because that's what's going to be available when you go to get your vaccine. But I'm just letting you know, since that was the question that was asked.
So okay. So I'm gonna follow your logic. I got my community hat on. I'm being the dude I ran into at the grocery store. Look, so but I've had COVID twice. That doesn't mean I'm good. Like, I had COVID twice, and can I just go ahead and get the update? Why do I have to start over and get all those shots?
Well, you don't have to start over, and I'll let Dr. Naidoo respond, but you don't have to start over, and it really is going to depend on how far you are away from that last infection. Certainly, we know that you have some degree of protection. Certainly, if you've had an infection recently with this variant circulating, you could probably wait 60 or 90 days before getting your vaccine. You probably do have some coverage. I think there's pretty good data on that. If you had a native, we call that a native infection, meaning you were actually infected with COVID and it was last year, I wouldn't count that. You could go ahead and get your booster, because last year was another variant. We're talking about these variants, and your infection needs to be within this time period that we're having the variant, probably within less than 90 days. But I'll let Dr. Naidoo respond to.
No, I think you said it all, Dr. Morgan. Perfectly said. Still get vaccinated, even if you had COVID. There's lots of data showing that so certainly you do get some immunity when you get COVID. When you get the vaccine, on top of that, you get significant immunity, and so there is plenty of additional benefit to getting vaccinated as well. So don't, a person's plan for COVID should not be, I'm just gonna get COVID and kind of wing it with my immunity. No, still get vaccinated even if you've had COVID.
Right.
So I'm going to ask.
That is a hope. That's not a plan.
So the question, one of the other questions of questions is, now we're moving into, right now I have these COVID variants. How many variants are circulating right now? How many variants are we concerned about right now?
There are at least 2 that account for most of the infections in the U.S. right now. There are always other sort of variants of interest, so not quite circulating high enough outside the U.S. and sometimes in small pockets in the U.S. But there are 2 that are contribute to most of the infections right now.
So we have those 2. We have the flu. We have RSV. We have any of a number of, I'll just put 2 or 3 different variations of the common cold out there. We have monkeypox. How many shots? The question again, man, how many shots you want me to take? Like, seriously? Like, what? Why can't I be one and done? The question is it possible? Is it safe for me to take all of the vaccines that are available? And should I get them at the same time? Should I space them out? If you can go through the different possible respiratory viruses that now that we're in the season, how should I relate my vaccines to those different viruses?
And maybe I'll start with that just to say, and then Dr. Naidoo, you can certainly, chime in with the therapy, but maybe let's just take a step back and ask ourselves, Why are we having all of these viruses here? Let's think about that for a second. We talk about COVID, um, which really started in 2003. By and large, we've been able to keep it out of the United States. Here we are battling it for the last 2.5 years. We have monkeypox. Monkeypox is certainly not unknown in the world, but by and large, it was endemic in Central and West Africa, almost not seen here in the United States. In fact, most doctors have never treated a single case if you're an American physician. And yet we see a rise in monkeypox in areas of the world where historically it has never thrived. We see it in Europe. We see it in the United States. We see it in large numbers in the United States, in Europe. And we have to begin to think about, what does this mean in a larger context of viruses in general? Battling COVID, monkeypox has come up where we haven't seen it before. We see isolated cases of polio coming up in our wastewater that we haven't seen before. And so we have to begin to put all of this together and say, this cannot be a coincidence. Let's not be naive about this. There must be a reason that all of this is happening. And again, I would just say we need to begin to understand our behavior and how our behavior contributes to this, including the refusal of vaccines, all vaccines. And I think you alluded to some of those, Dr. Griggs, throughout your childhood and adolescent years, not getting vaccinated. When we have a significant portion, a significant, whatever that number is, a significant enough slice of the population that is not getting vaccinated, then the rest of the population starts to be at risk. The unvaccinated can remain unvaccinated as long as the rest of us provide that, what they call that herd immunity around to protect them. So the unvaccinated don't stay healthy because they have some higher degree of immune system or have reached some level of mental nirvana and meditation. No, they stay healthy because the three of us get our shots and they live in our environment. So in fact, their health is dependent on us. They are not independent. A lot of people refuse vaccines so they can maintain their independence, but by doing so, it actually makes them dependent on the rest of us. If enough people join this movement and not get vaccinated, then I think we begin to see the beginnings of what we have now. Monkeypox in the United States, polio in the wastewater. We've got to begin to connect the dots and understand what this all means.
Thank you, Dr. Morgan. Dr. Naidu.
That is perfectly said. And I will just say that vaccines have been one of the greatest public health innovations in human history. The amount of lives that have been saved because we have vaccines is astronomical. The infant mortality rates 100 years ago, 200 years ago, were so much higher than what we have now. Like, we live longer because of vaccines. And I think maybe mentally or collectively, we've sort of lost track of that. To speak to your question about getting all these vaccines, the first thing I just want to say is that these vaccines are safe. COVID vaccine is safe. Influenza vaccine is safe. Monkeypox vaccine, for those who it's recommended for, is safe as well. That's the first thing I want to say. In terms of a vaccine, before vaccines actually come out to the point where they're used on humans, there's a whole lot of rigorous testing, safety testing, making sure that it's safe in humans, efficacy testing, making sure that it actually works to do what it's supposed to. There's a whole lot of testing that happens prior to vaccine, getting to the point where it could be used in humans. And then to answer the specific question of, can I get all these shots at the same time? Yeah. The answer is yes. But I will say that just get the shots. So whatever you're comfortable with, when people ask me, can I get all these at the same time? I'll say it is safe to do that. The way your immune system works in terms of particularly COVID and the flu vaccine, The way your immune system works, it is certainly safe to get both. But if you want to space it out by a day or two or a week, that's okay. Just get the vaccines.
So you brought up a great point. You said Mpox for who's eligible. Can we talk about who's eligible and what are the parameters that go along with the different viruses and the updated booster as well? Who should get the COVID vaccine? Who should get the booster? Let's start there.
Everyone should get the COVID vaccine down to age 5. I don't work with the peds, but I believe it is approved all the way down to age 5. So everyone should get the vaccine and everyone should get boosted. Speaking to, should get the vaccine all the way to getting a booster. I think the last numbers when I checked, I think 35% of Americans have had at least one booster, which is extremely low. If you really think about this, and that's not really going to be enough for us to really provide the safety that our communities need. I just want to plug too that vaccine rates amongst Black people are lower than other populations. Black people and people of Hispanic ethnicity collectively have the lowest vaccine rates currently in the U.S. And so basically everyone above 5 should get vaccinated for COVID.
So are there special recommendations for this bivalent booster that's out?
Everyone should get bivalent booster.
Dr. Morgan? Dr. Morgan?
Yeah, no, absolutely. And remember, you're only eligible for the booster if you've completed your primary series. And that includes all Americans who received that single dose of Johnson & Johnson. That includes you. You need to get this bivalent booster. The boosters can be given with all other vaccines. Monkeypox is the only vaccine that I would say talk with your doctor before you get it at the same time as the COVID. The reason for that is not that it's not safe, but there could be an increased risk of this myocarditis we talked about, this inflammation of the heart muscle. You may have heard about it. Sometimes can occur in young males. It's not common. In fact, it's more common to get myocarditis from a COVID infection than from the vaccines. But it is a noted side effect of the vaccine. But again, I want to be clear, your risk of myocarditis is greater from being infected with COVID than it is from getting the vaccine. But in combining the COVID vaccines and the monkeypox vaccine, you may have a combined risk of myocarditis. It doesn't mean that you shouldn't do it. It just means that you should check with your physician. If you certainly are in a high risk group for monkeypox or have had a known exposure, then you probably should move forward with that. But in consultation with your doctor, we absolutely want to stem the monkeypox rise as well. And so we don't want you deselecting vaccines, but we also don't want you to make that decision on your own. Talk with your physician about it and make certain you get good information.
So we can't have, usually the elephant in the room is COVID, but now the elephant in the room is the flu because people are confused. If you remember the first year of the pandemic, people were not realizing what they were doing. We did so well with the social distancing and wearing a mask and we were apart that the flu numbers were actually down. But if you look at what's happening in the southern hemisphere of the world, if you look at what's happening in Australia, it's projected that based on their numbers, we're going to have a very harsh flu season. So with that said, is it safe? Why should I worry about getting the flu? That's way over there. That doesn't have anything to do with me over here. Why should I get a flu shot? You want me to take all these shots? Why do I have to worry about the flu? I thought we had that. I thought we got that. I thought we're over it.
One way to look at that is one of the reasons that we are being projected to have a harsh flu season is because we haven't really followed public health measures. And so again, we have to look inward to understand how our behaviors are continuing to drive the pandemic. You made a great point. When we followed, or at least some part of our society was following public health measures, we saw flu rates decrease. And so we need to understand that all of these are viruses, even though they may not be in the same family of viruses. That respiratory viruses generally are spread in similar ways. And so we should be concerned with the flu. The flu does kill, and certainly those who are immunocompromised and the elderly can be at risk. So the flu, while you might be at home taking over-the-counter meds and be miserable for 4 or 5 days and maybe not go to work, it can be lethal for other people. And so again, we've got to begin to think about other people. We all are interconnected in this society. It's not only about you, because one day you may need to depend on someone else for your health. Just because you have the privilege of being healthy now, recognize that that is a privilege that can change on a dime. And the decision that you make, and I'll go out on a limb and say selfishly, could be a decision that comes back to bite you later when you find yourself in a position where you're depending on others to take care of themselves such that you can have a quality of life.
Dr. Naidu, on that note, the flu kills between 12,000 to 50,000 people a year. What's different this time? Is there something, what's the difference in the messaging now?
Yeah, so I think my internet may have broken up a little bit, but I think your question basically was, what do we do now in terms of the current flu season?
Yes.
And so, I think that the point that Dr. Morgan made is an excellent point. We have influenza vaccines. We talked a little bit about the COVID vaccine being bivalent, meaning sort of two strains, if you will. The flu vaccine is quadrivalent. So they're basically 4 strains, and they basically look at what's happening in other parts of the world and then predict what would happen here during the cold season. And most of the times that prediction is relatively close. And so it's really important that everyone consider very strongly getting the influenza vaccine. There are a couple of reasons. One, it does, even if you still get the flu after you get the flu vaccine, it decreases the likelihood of you having a severe complication or a severe illness with the flu. The second thing is that there is data showing that those who get the flu vaccine every year, each year kind of build up cumulative amounts of immunity so that when they do get the flu, it appears like it's milder. There is some new data in our infectious disease literature showing that. And so, vaccines work. And I'd really, really encourage everyone listening and to not just for themselves, but to talk to others in their community to really consider getting the influenza vaccine.
So
those who don't get their flu shot and develop the flu actually end up with a higher risk of heart disease. They have a higher risk of heart attacks and other cardiovascular complications that's well known. And so that is sort of a downstream positive protection that you have from getting this flu shot, because cardiovascular complications are well known, certainly heart attacks in people who have not received their flu shot. So something else for you to think about. Certainly, if you have high blood pressure, if you have high cholesterol, if you've got heart disease, if you're taking medications for any number of things, including diabetes, you may want to think about taking the flu shot as part of your protection of your cardiovascular health if you're not concerned about public health or getting infected yourself. You might think about how this might contribute to your overall cardiac heart status.
So we have a few questions from our audience. One is from Carl in Chicago. He says, how should I ask for an updated vaccine and where can I get one?
Yeah, and so it sounds like Carl is in Chicago. That is a phenomenal question. So one, if you have a primary care doctor, you can get it from there. Two, most of the pharmacies, the neighborhood pharmacies, carry the COVID vaccine, and so you can go to your local neighborhood pharmacy. And as Dr. Morgan alluded to, if you've already had your initial vaccines, then you'll be eligible to get the updated vaccine, the updated booster vaccine.
Thank you. The next question we have is, it says, do we think that that we'll be living with COVID-19 and its variants for years to come, similarly to the way that we live with the flu?
That's a very good question. And so my suspicion is that we will be living with COVID for some time. But I think that if we trust in science and we continue investing in science, and we listen to science, that will keep developing tools that will be able to minimize its impact on us and keep us healthy.
Dr. Morgan, any thoughts on variants?
No, I agree with what Dr. Nadeau said. We certainly will have to continue to live with it. We've had so many infections with this Omicron. We see what's happening in Europe. In some ways, we're just bracing for what will happen with the next variant. But we have the tools and the knowledge to keep ourselves safe if we choose to use them. And so that's a lot of what this webinar is about. We know the tools, including the public health measures, washing your hands, using your home COVID test, practicing social distancing, covering your face and mouth. I am going to espouse the value of masking. Certainly if you're indoors, certainly if you're in a crowded situation, and certainly if you're in an area that has a substantial level of transmission with these CDC maps, you need to consider masking. And so it's an unpopular stance, but there it is. And all of these coming together is what will try to get us over the hump and off the merry-go-round. Otherwise, we're just all on different horses on the merry-go-round. We just keep getting up and we switch horses, and the merry-go-round just keeps going round and round.
So, that's an excellent point. We have it's a question/statement. It's almost a rhetorical question from Michael Shenton. He says, and it's an opportunity for a history lesson, and based on our history, I know Dr. Nadeau enjoys these opportunities. What if Black scientists and doctors worked on the science and a potential cure for such, and so on and so forth, they say. Who wants, Dr. Morgan, Dr. Nadeau, who wants to go with Dr. Kizzmekia Corbett? I'll just throw that up there and just let y'all have it.
No, I think you make a good point. Dr. Kizzmekia Corbett basically worked on Moderna from its inception all the way through.
She happens to be a what from, yeah.
She is a scientist, a Black woman scientist.
I'm from my home state of North Carolina, by the way. Shout out. No.
Oh, I didn't know you were from North Carolina.
There it is.
That's what's up. But yeah, no, I think that's a very good question. And so science is about discovery. And as we discover new therapeutics, we test it to see if it works in the lab. If it kills the virus in the lab, then we test it on animals to make sure it's safe, at least in animals. Then we test it on a small number of people. And that's kind of how these things develop. And so we do have, I think the reference would be to cure. We have treatments right now that have been sort of tested. We have a pill called Paxlovid that is available to sort of help reduce the severity of COVID, reduce how long a person is infectious. We have infusion treatments as well for those who are at high risk. But I would just say that, and I also want to point out that there is more investment ongoing to look at other things that could be useful as far as treatments. I do want to say that prevention is always, always, always better than cure. Our strategy should not be, hey, let's just hope that these treatments, work, and let's just all have at it. No, we still need to focus on prevention, vaccines, and mask wearing, particularly in the areas where there's high transmission and in indoor spaces.
So we're coming to the last 5 minutes of our webinar, and I started, as you can see, I've started to lighten up. I started in the dark, and I'm starting to lighten up. So I want to go towards this comma in our conversation, because I've enjoyed it and I want us to keep going. As we talk about where are we now, what are the positive things that you want our viewers to know? A, that they can do for themselves, but B, as where we are and where we're going with this pandemic. I'll start with Dr. Morgan.
Yeah, and I just wanted to add to the question that Michael Shinton put on. When we talk about what Black scientists are doing, we should also think about what Black scientists have done. And most of us don't really know much about our history and about ourselves because we're not taught our history in schools. It's our history is not considered part of American history. But the fact of the matter is, vaccines came to the United States by an African named Onesimus in the 1700s. And he taught the process of variolation to the doctors in Boston. When we talk about how these vaccines get to us, we've got this cold chain requirement. They required very cold temperatures to be transported. The person who invented refrigerated trucks was a Black man named Frederick McKinley Jones. Without him, we wouldn't even be able to get the vaccines that Onesimus brought to us, that Kizzmekia Corbett developed. And it was the refrigerated trucks and planes and refrigerated mobile containers that Frederick McKinley Jones invented that allowed the distribution of these vaccines. So we need to understand our history and how it contributes. Certainly we can continue to move forward. We are not written in the history books, but that is our contribution to these vaccines, and we need to understand it, even if it's not taught to us. Make sure that you know it. Black scientists have been at the core of why we have vaccines, of why smallpox was eradicated.
Thank you, Dr. Morgan. Dr. Nadeau, you talk about ending on a positive. That's a bright, shining light if I've ever heard one. What you got, Dr. Nadeau? Good luck with that.
Just to echo what Dr. Morgan said, we have certainly contributed a lot to science, to vaccines, and even with the COVID rollout, there were many people of color, many Black and Hispanic and Indigenous people who were consulted along the way and provided guidance in terms of the clinical trials that happened. So vaccines are safe. Please consider getting vaccinated. Talk with your doctors. Talk to respected people, people who have medical training about vaccines, and consider getting your shot.
Wow. And with that, folks, I'd like to say thank you to our sponsors. Thank you to the Department of Health and Human Services. Thank you to the 100 Black Men of America. Of course, we couldn't do this without our sponsors. Again, Dr. Morgan, Dr. Nadeau, my hats off to a robust conversation. I started back here, and now I'm here in the light. Folks, we want to encourage you to go ahead and get vaccinated. Ask the hard questions. Get your flu shot. Get your Mpox vaccine if you're eligible. Get your COVID shots and boosters as they become available. Wear your mask. Help me, docs, if I leave anything out. Wear your mask. Social distance. Smile. Be happy. Get checked. Get fit. Get moving. Thank you. Thank you again, and we look forward to talking to you again.
Bye. Thanks for having me.